adductor brevis, longus and magnus, pectineus, ASIS, sartorius, rectus femoris, iliac crus,
Here.
gluteus medius,
Here on the side.
tensor fasciolata,
Right here.
IT band,
Right here.
greater trochanter,
Right here.
trochanteric bursa,
Over the greater trochanter.
sacral crus,
Mm-hmm.
PSIS,
These are here.
gluteus maximus,
Right here.
ischial tuberosity,
Right here.
sciatic nerve,
Right here.
hamstring muscle group.
Right here. Alright, I'm going to go into active range of motion now. I'm going to do hip flexion first. I'm going to have you bring your leg up to me to start. Or hip extension, not hip flexion. Bring it up to me. Alright, good. And then I'm going to put this here and do that again for me. Alright, and hers is at 15, which is in the normal range of 10 to 20. Alright, so I'm going to have her flip over. And I'm going to have you bring your knee up, or bring your leg up, not your knee. And this is for hip flexion. So I'm going to do this and have you do that again. And hers is at 125, which is in the normal range of 120 to 130. And then we're going to go into hip abduction. So I'm going to have you bring your leg out to me like this. All right, back in. I'm going to have you do the same thing. And hers is at about 47, which is a little over the normal of 45. And then I'm going to have you move this leg out of the way and bring your leg in towards me here. All right, take it back out. And I'm going to have you do that again. And then that one is at about 32, which is a little over the normal range of 30. All right, so now I'm going to have you come to the end of the table for internal and external rotation. So for internal rotation, first actually I'm going to put this little bolster under your knee. For internal rotation, come out. External rotation, come in. All right. So for internal rotation, I'm going to bring it out. And hers is at 44, which is right under the normal range of 45. And then I'm going to do external rotation, bring it in. And that is at about 47, which is just under the normal of 50. So now I'm going to go into passive range of motion. So for this one, I'm going to bring it up, and that should have a firm end feel. And then bend your knee and bring it up. That should have a soft end feel. Then I'm going to go into extension, so I'm going to have you flip over. And lay flat. Bring it up. That should have a firm end feel. Up. That should have a firm end feel. Okay. And then I'm going to go into abduction. And you're going to lay on your side. And I'm going to bring it up like that. And that should have a firm end feel. And then I'm going to have you lay back over. And we're going to do adduction. So I'm going to put that leg like that. Stabilize. And I'm going to bring it in like that. And that should have a firm end feel. Then I'm going to have you come down to the end of the table. Put here. And then do internal rotation and then external rotation, and those should both have firm and feels. So after that, I'm going to go into manual muscle testing. I'm going to do hip flexion. So for the first one, do here, and then I'm going to have you put your leg up, and then I'm going to do that, and I'm going to have you push up. Alright, hers is 5 out of 5, and that is testing for the rectus femoris. And then I'm going to have her, this one I'm going to have you sit up, and you're going to flex your knee over the table, on the side of the table. And I'm going to do that and put the hand here. And I'm gonna lift up, keep moving, and push up against my hand. Alright. And that is testing the iliopsoas muscle group. Alright, I have you lay over and do hip extension. So for the first one, I'm gonna do this. And put your leg up a little bit, push up against my hand, and that is 5 out of 5, so her muscle strength is good, and that one is testing the hamstrings. And then I'm going to flex your knee to 90 and hold this up a little bit and push up against my hand. And hers is 5 out of 5, and it's testing the gluteus maximus. And then I'm going to do hip abduction for manual muscle testing. So have her lay on her side, and then I have you push up against my hand, and that's 5 out of 5, and it's testing the adductor muscle groups, the pectineus and the gracilis. And then, or never mind, that's the opposite one. Abduction is testing the gluteus medius and the minimus. And then we're going to do adduction. Oh, never mind, go back to your side. Ooh. And I'm going to here and push up against my hand. And this one is testing the adductor group, the pectineus and the gracilis. Alright, then I'm going to do manual muscle testing for internal and external rotation. And then here, and for internal rotation, have you push out with my hand, and that is 5 out of 5, and that one is also testing the adductor group, and then the medial hamstring muscles and the gluteus medius and minimus. Then for external, I'm gonna do that. Push up against me, and hers is 5 out of 5, and that one is testing the biceps femoris, gluteus maximus, piriformis, sartorius, and then the external rotator group. Now I'm gonna go into special tests. So I'm gonna have you lay on your side for the iliac crest compression. And I'm gonna push down on that one, and if there's pain arising from the SI joint, it's possible SI ligament irritation or sprain. And I'm gonna have you lay on your back again. I'm gonna press opposite, I'm gonna push down. And if there's pain arising from the SI joint, it's a possible SI ligament irritation or sprain again for that one. And that's the anterior distraction. And now for the fulcrum test, I'm going to have you come down to the end of the table. Put my forearm under here, and then I'm going to push down. And if there's pain when there's pressure applied, it's a possible femoral neck stress fracture. Now I'm going to do the hip scouring test. I'm going to have you lay back again. And then I'm going to open in, and then I'm gonna pressure while I internally and externally rotate. And if there is pain, then it's a possible defect in the articular cartilage of the acetabulum or a possible labral tear. Then for the next one, I'm gonna have you cross over like that, and then do this, one hand here, and do that, and then I'm gonna push down. And then if the involved thigh remains elevated above the opposite leg or there's pain in the SI joint, it is indicated of limited hip mobility due to iliopsoas spasm or SI dysfunction. And then we're going to go into the Gaines lens. So I'm going to have you lay on your side. And I'm going to have you bring your lower leg up. And then I'm going to extend the hip. And if there's a pain arising from the SI joint, it's hip pathology or L4 nerve lesion. And then I'm going to go into Ober's. So you're going to lay on your side again. And you're going to have your knees and you're going to extend. And then one hand here. And then I'm going to abduct, extend. And then I'm going to let it adduct slowly. And for that one, if the pelvis moves before the leg becomes adducted or the leg remains in an abducted position, it's the tightness of the IT band. So next, I'm going to do the Thomas Kendall test. So I'm going to have you come down to the end of the table. I'm going to have you grab your knee and bring it to your chest. And then lay back. And then if the lower leg, if the knee remains in extension or the lower leg is not perpendicular to the floor, it's tightness of the rectus femoris muscle. And if the upper thigh doesn't contact the table or is not parallel to the floor, it's tightness of the iliopsoas muscle group. And now we're going to go into the Eli's test. So I'm going to need you to flip over. And then I'm gonna stabilize the pelvis, and then I'm gonna flex here. And then when the knee is flexed, the hip also flexes. It's tightness of the rectus femoral. And then we're gonna go into the Trendelenburg. So I'm gonna need you to stand up. I'm gonna put my hand on your hips and I'm gonna have you stand on one leg. And if the non-weight bearing side drops, then it's indicated of a weakness of the gluteus medius muscle. And next I'm gonna do the piriformis test. So I'm gonna need you to lay on your side, hip flex to 60, knee flex to 90, and then have you come closer to the end of the table. Gonna push down while stabilizing. And for that one, if there's tightness pain, it's an indicator for piriformis syndrome, which is a possible entrapment of the sciatic nerve. And then we're gonna go into neurovascular testing. So I'm gonna do the femoral nerve traction test. So I'm gonna have you bring both of your knees to 90, and then I'm gonna be behind you. And then I'm gonna keep the knee flex to 90 and move it back. And if there's pain or paresthesia in the anterior and lateral thigh, it's nerve root impingement of the L2, 3, and 4. And then I'm gonna do the hamstring tendon reflex. So for this one, this, and then gonna knee flex to total of 30. So move that right there. And then if there's a pathological reflex of the L5 and S1 nerve root, it's the medial hamstring muscles. There's pathological reflex of the S1 and S2 nerve root, it's lateral hamstring muscle. And if it's bilaterally, it's an upper motor neuron lesion. And if it's unilateral, it's a lower motor neuron lesion. And then I'm going to go into monotones and duratones really quick. So if you would flip over. Alright, so L1 goes here, L2 goes here, L3 goes here, L4 goes here, L5 goes here, and then for those ones, the myotome for L1 is hip flexion, the myotome for L2 is hip flexion, for L3 is knee extension, L4 ankle dorsiflexion, and L5 great toe extension. And then L2 through 5 are the patellar tendon reflex testing. And then if you would flip over really quick. S1 goes down here, and it goes down to the 5th down there, and then S2 goes down here through the gastroc down to the heel, and then the myotome testing for S1 is ankle plantar flexion, and for S2 it's knee flexion, and those both test the Achilles tendon. So I'm going to have you scoot to the edge of the table. And then this is the one for the patellar tendon. Alright, and then the Achilles. And that is it.